hear, if you're online, please tell us. Put it in the chat, and the wonderful Mike here will try to resolve it, I believe. And just so you know, you're in the right session. I say welcome to Open Spaces and welcome to Breathe, exploring air pollution and lung health through multiple lenses: respiratory medicine, public health, and fine arts. So you have a real feast of a mixture. If you're at home, feel free to grab yourself a drink or a snack. Those of you who are here are going to get free food afterwards, so you'll get a drink, something to eat. So hopefully we can then carry on the discussion afterwards. Any technical questions, please put them in the chat. But also, actually, if observations or ideas come to you when you're listening and you're online, please put them in the chat, because we will actually gather them up and put them to the speakers. So I'll just tell you a little bit about the format. So I think Dr. Helen Meredith, our consultant respiratory physician, will be speaking first of all, and she's going to give you a sort of short introduction to her practice, possibly in relation to air pollution. Then Dryden Goodwin is going to share some of his extraordinary work visually with you. And so again, if you can't see it, for goodness sake, let us know. But hopefully he'll be sharing that both in the UK and in Lahore. And we're really lucky to have him here, as we're lucky to have you here. And then after that, we're going to zoom out again even further. And Dr. Richard Alderslade, a public health expert at St. George's, and many other places, which I'll get to when I introduce him, is going to give us the benefit of his public health expertise. And I hope that all these three strands will come together in a very sort of interesting fabric. While the talks are going on, or the presentations, I'll ask if you could keep your cameras and your mics off. When we have the discussion, please put them on, because it would be really lovely for you to join us. You know, even if you're online, you can still take part in the conversation. And likewise, those of you in the room, please do put your hands up and we can have a rich discussion and then take that over into the into refreshments. There shouldn't be a fire alarm. So if there is a fire alarm, leave by the nearest exit, and the outside, the nearest place is over there. I think that's all I'm meant to be saying. We are recording this because there are people who either haven't known about it or couldn't get here, so we're going to record it. So you'll get a second chance to listen to it. So I think to start us off, I'm going to introduce the wonderful Dr. Helen Meredith, who has offered to speak with us tonight. She's a consultant respiratory physician at St. George's Hospital. She's been a consultant for 12 years, working at St. George's Hospital for the last 9 years. She's the group lead there, and she leads the team providing respiratory second care for Wandsworth and Merton, as well as tertiary services across southwest London. And she held the degrees of MA from Cambridge University, and MBBS from the Royal Free. And she completed her respiratory training in hospitals across the northeast of London, and really exploring the impact of health inequalities on patients there. So really relevant to environmental pollution and the way that that impacts on all aspects of respiratory health. So she's going to introduce something of her practice before Dryden then shares his screen. Helen, and I'm sorry you won't be able to see us at the moment, but in the panel discussion, you will be able to put names to faces, and we might introduce them again briefly so you know who they are. So thanks for bearing with us.
Hope they can work out who Helen is, but yeah. Well, there's the two of
Dr. Helen Meredith.
Thank you, yeah. Hi, so I'm Helen Meredith. I was actually going to start, it's about my practice, but I'm going to start way back with the Meredith, but no, a vague link with public health and clean hair in that my father, who was born in 1923, so quite old, is no longer with us, but one of his first jobs was the solicitor for Salford Council in the early 1950s. And so there's a video of him in some Salford. We had it on the TV at one point where we were given it of the back of his head for Salford Council, where they're trying to enact the first clean air zone in the UK. By 1956, you have the Clean Air Act, but a few cities were trying to put in clean air zones before that. And so I'm from Bolton, so built on cotton, built on very polluting industry. Manchester, sort of the birth of the Industrial Revolution, and we had this very visible air pollution then. Everywhere was coated in black, and so lots of work done then, and we lost that black partly because it was cheaper to export it elsewhere, partly because people were doing on work to improve that air quality. But I think really from the Meredith point of view, I think we then have a lull in terms of people recognising. My father didn't particularly talk about that work or continue through the rest of his life. And I think from a personal point of view, so I went to medical school. This wasn't talked about. We had this visible air pollution. We had this black coating. We had the smogs in the 1950s and 1960s. And then with that visible, we now have this invisible polluting materials that I think we all sort of were lulled with and not really thinking about the massive impact on health that those have. And certainly, so we went in medical school, nothing talked about. From a respiratory point of view, smoking is the king of evil and still is. But really, through my training until really quite recently, we talk about smoking and that being our big public health issue, and it still is our biggest public health issue. But I think it's really very recent years that sort of the understanding the impact of outdoor and indoor, but particularly outdoor from this point of view, air pollution. I think we still have limited understanding on terms of indoor air pollution and how that interacts with people, other than well, we have particularly known allergies and it driving some asthma disease. So partly my sort of recognition of this, I think slight embarrassment, but it's more because through my family we're starting to sort of focus on, and I think it's a lot is when you say what's visible, what's invisible, what's in front of us, how much do we notice it, and it's having children that really sort of, so my stepson start up, and I have a 6-year-old now as well, but my stepson's starting to go to school, and you're seeing, you know, the cars idling, and then this child, well, it's very much where Dryden's sort of inspiration came from as well. But this tiny little being who's right there at the level of the exhaust, and we now know has more vulnerability, both because of developing lungs, but also they increased respiratory rate than us. So it's breathing in this sort of noxious compounds of things that to damage them. And then over the last 5-10 years, it's sort of increasing understanding within the respiratory community of the damage this is doing, and it's both of the causative nature, so increasingly recognising that air pollution causes some of our respiratory diseases like COPD. So it used to be essentially when it's all smoking related. Certainly, if we go to other countries, so lower income countries, a significant proportion of it's not. There is a significant proportion who are never smokers, and it is air pollution that's done it, either from things like biomass in cooking in homes or compounded with the outdoor air pollution. Then also realising how much it impacts on our patients, not necessarily causing their respiratory, so it can be the reason why they've developed lung damage, but when they've got lung damage, how it sort of worsens their condition. And I think that's a really difficult thing to talk about with our patients, because it's not something you can't avoid breathing. There is advice, so I would say relatively recent. I think we sort of ended up with national advice. We've got the British Thoracic Society gave a statement a couple of years ago about advice on air quality and work we felt we as respiratory community should be doing. And NICE gave some recommendations a few years ago, the last 4 years, to suggest how we as respiratory but also cardiology doctors should be giving patients advice about how to monitor air quality. And what they might adjust in their lives around it. I find that one very difficult. It is something we do discuss with patients. But if I gave another example, that the pandemic was excellent, or sort of not the lockdown periods were really, really good to stop having respiratory exacerbations. So COPD, asthma, bronchiectasis, all of our patients had much fewer exacerbations of their chest, so either infections or things, and that's all what drives the worsening of their condition. But obviously incredibly harmful for their health in terms of deconditioning, from the social isolation, other problems. So very difficult to talk to patients about, or to get that balance right for patients, to say, well, don't go outside and exercise on certain days, but equally exercise is good for you. Or actually, if you then start feeling trapped in your house, that's incredibly significant psychological impact. So I still think it's very hard. This isn't something that as an individual you can do a lot about. You can monitor you can avoid. You can give tips such as, you know, when you talk to patients about sort of walking the far edge of the pavement to be further away, there's quite a big drop off in particulate matter. Maybe considering, particularly for asthmatics who really, it does really sort of stir up the disease on days with higher pollution, that you might avoid going outside. But that's a big limitation to your life around things. And obviously, if people are interested, whether they, you know, getting involved with community or to talk to MPs or stuff around lobbying, it maybe feels a bit more positive action, to be able to sort of take hold of things rather than have something done to you. But very, very challenging. So I'm really interested to come to listen tonight, to hear and to see what other people's thoughts are. It's something I feel very worried about in terms of future generations and where we go. And my patients haven't talked particularly, but, you know, social inequality, health inequalities, it's really affecting people who are already in a difficult situation more than others. But, you know, there's so much we could talk about, but really interested to see in terms of Dryden. I think it's really powerful work that illustrates this well, and gives visibility to say what's quite an invisible other. So yeah, really interested to see, happy to contribute in terms of other things afterwards. But yeah, that was me, just as a brief introduction.
Thank you so much. That was Dr. Helen Meredith, and you will see her. At some point you will see her. I'm just going to get rid of that annoying little message. But it's really interesting to hear.
I don't know if that people can hear.
Mike's keeping an eye on that.
Brilliant, yeah.
Yeah. So I'm just going to share the PowerPoint.
Oh yes, I'll just plug in this. Oops, sorry. Sorry.
I get this in here. Okay, that's going to pick up everything. Hopefully you can see this, and it's really interesting stuff. You're talking about the sort of personal autonomy or collective, what can we do collectively? And those really difficult conversations that I hadn't thought about really is how much, whatever conversations you have with the patient, how much control do any of us actually have over where we live or what the air we breathe is. So it's fantastic that your work, I think, really raises awareness of that in a really visible way, as Helen would say. So this is Professor Dryden Goodwin. I was going to introduce him as well. He's my good friend and colleague at the Slade School of Fine Art. So he's a visual artist and Professor of Fine Art at Slade at UCL. And his work, as you're about to see, is defined by a really rich dialogue between drawing, animation, photography, film and sound. And he's always sort of consistently focused on the human figure and questioned the portrait form. He makes work for public spaces, galleries, museums, cinemas, and looks at those sort of dynamics of human relationships. He's exhibited all over the place, so I can't give an exhaustive list of everywhere you've exhibited, both nationally and internationally, to great acclaim and really exciting work. So he's exhibited for Quad in Derby, on Earth, I can't pronounce this, in Xi'an in China, for the Queen's House, Royal Museums, Greenwich, the Hasselblad Foundation, Gothenburg, the Photographers Gallery, London. He's done projects in public spaces, including this ongoing Breathe series, which was produced by Invisible Dust. Also Linear and Art on the Underground, some of his sort of solo exhibitions, and many, many group exhibitions, including Lahore Biennale, which he's just come back from, Salisbury Cathedral, and the Wellcome Collection. And his work has also been nominated as Best Feature Documentary in Copenhagen at the CPH Doc, and the 24th Camera Image
in Bydgoszcz in Poland.
In Poland. But it is a real honour and a real treat to have you here. So thank you so much. And that does not do justice to you, but this will.
Thank you, Deborah. Yeah, no, it's great to be here. Lovely to see everyone, and thank you for inviting me, Deborah. It's a real pleasure to be here, and great to meet Helen and Richard in person, and great to see Michael, and to be able to talk about Breathe. And I just want to give I suppose, to tell the story of Breathe from its first manifestation in 2012, and then to talk about its most recent manifestation in Lahore, which I've just recently come back from. Yes, yes, no, absolutely. I'll get into. I've got to go across two screens, so bear with me a bit. So, Breathe, as Deborah said, was first commissioned and produced by Invisible Dust, who are an art science organisation, and what they do, they bring artists and scientists together to have a conversation, and through that conversation, an artwork might emerge. And I was connected to Professor Frank Kelly, who's an expert in lung health, and he's based at King's College in London. And he's become sort of the key advisor to the government around air pollution, and was very involved in the ULEZ zone that emerged. And my conversations with Frank helped me form the fundaments of the work that I wanted to make. And the realization, I suppose the fundamental fact that the act of breathing embodies the animation of life. Oh, this one here, yeah. So when making what ended up being over 1,300 drawings of my youngest son, who was 5 years old at the time, I felt I was literally drawing breath into his body. And this process of repeatedly drawing him encapsulated a sense of nurturing and sustaining. And through this drawing animation that emerged, I wanted to induce this heightened consciousness about the act of breathing, and it being the first sign of animate life, and also the last register at the moment of passing. And then through my, from working intensely in my studio in Southeast London in Deptford, there was a shift in scale. Breathe was originally installed on this screen opposite the Houses of Parliament on St Thomas's Hospital and next to Westminster Bridge. Significant, this overlooking one of the Western world's most powerful institutions, and an institution whose laws defined and decided the quality of air that my son was breathing growing up in the city. Air that both can sustain him but also corrupt his body. So let me play this. So here's the projection on St Thomas's Hospital, and the rhythms in the animation. At times he looks skyward, and other times he looks directly out towards the Houses of Parliament, I suppose, calling to account. And at other times he's looking below to the people that are passing him in this high vantage point. And I suppose that the piece reflects on these environmental challenges that we all are experiencing, polluted air, but also this sort of universal hope for the preservation of life. And I became excited by this shift, the shift in scale, these very small, fragile drawings, but how they became this urgent carrier of information. Breathe was this portrayal of my son's vulnerability here, chimes of Big Ben. So his vulnerability, but also an attempt to translate into a very visceral experience how the personal and the individual can become more universal. And what was significant for me was the drawings had to be small because there were so many of them. But when enlarged to this size, I liked how the register within the cityscape, they held a kind of fragility, but they also had their own sort of boldness to them. So in 2022, so 10 years on, I revisited Breathe, and I made Breathe 2022. And this came following an invitation from Lewisham Borough of Culture, and I live in Lewisham, to make a work, and it seemed a very sort of timely point to revisit the project. And again, I work with Invisible Dust, and having worked with Alice Sharp, who's the director of Visible Dust, I then started to work for these new iterations with Lucy Wood, who became the producer of the project. So, Breathe 2022, I made this new body of over 1,300 drawings, and what was really important here these were 6 local activists, and all of them residents from Lewisham, my home borough, each of them striving for climate justice and improved air quality, and each fighting for breath in their own way, urgently challenging and pushing for change to improve the quality of the air that we breathe. And just to give a shout out to each person here, I just wanted to acknowledge that in the middle here we have Anjali Rahman Middleton, and she's from an amazing group called Choked Up, which is working in Lewisham and beyond. And then there's also Alice Tate Hart, who's here on the bottom right-hand corner, and she's from an organisation called Mums for Lungs. And then Ted Burke, who's here in the centre, he is running an organisation, as well as being parts of Friends of the Earth. He's also running a local organisation called Clean Air for Catford. And then here at the top left-hand side is who became 15, my son, growing up and continuing to growing up in Lewisham. And he sort of continues, he's a keen sportsman, and he's continues to sort of talk about the challenges of air pollution. And then Tafare here, Tafare McCullough, who's at the time was a 9-year-old, and Tafare had this extraordinary knowledge of electric vehicles and had this really heightened consciousness about the sort of challenges that we're facing with air pollution. So these are all people who, well, I suppose all of us are passively affected by air pollution. And then these are a group of people who are all actively pushing the status quo and, I suppose, active agents of change. And just to give you a sense of the drawings here, this was a show at the Wellcome Collection, and these are 90 of the drawings, and you can see from over here my fat fingers how the scale of the drawings. And you know, critically, this is a 0.5 lead HB. It's, you know, just it was my weapon of choice making these drawings. This show is really interesting because it was called In the Air, and it explored our very complex relationship to the air that we breathe in very different ways. So it was a pleasure to be part of the show. Oh, sorry, I'm going to move on here. But there was something about the handheld nature of these drawings that became kind of really, really important. And then these drawings, this drawing here and the ones before, Lewisham found itself at the centre of the UK clean air debate. And these are drawings of Rosamond Adu-Kissy Deborah, who lives not so far away from me, but a short distance away. And Rosamond's campaign for clean air followed the death of her 9-year-old daughter, Ella, in 2013. And Ella had experienced a series of severe asthma attacks over several years. And Rosamond's campaign for air pollution to be included on her child's death certificate. Ella became the first person in the world whose death was officially recognised as being caused by air pollution. Air pollution being the significant factor that caused her death. And this landmark ruling happened in 2020, which was a really kind of significant moment. But Rosamund continues her fight for clean air justice, and she's raising awareness, and she's pushing for change in policy now. She's working with members of the British Parliament, and she's trying to pass a new law which would make breathing clean air a human right. And if that law gets activated, it would be called Ella's Law. So again, this shift from the seclusion of my studio to the scale of this public environment, and this essential relationship between the still and the moving image, which I think was there from the beginning, fundamental to the act of animation, but also to breathing. And the different ways that this sort of tension plays out with the different iterations around, first of all, this local area in Lewisham, as these sequences of posters. And I really loved these moments, this sort of act of the pasting up of the posters in the space, the different spaces, and then this kind of the different ways that people would see these works. So either they're walking past, or driving past, or on a bus, and these are sort of zoetropic sections from this much larger animation. And because there were so many drawings that I needed to make to reach the whole to complete the whole animation, over the 6 months it took me to make these drawings, I started off with just hundreds of drawings, which started then to materialize in the city. This is the local butcher. He's looking at the posters. And then as more and more drawings came, what was really exciting was there became new invitations. And these sort of locations were really important, always close to really busy roads. And yeah, there's something really, I suppose, really disturbing, fundamental about the acoustics and the taste of the pollution within the air, within these different environments. And to me, that became a really kind of important ingredient in how the work was experienced. And then what was amazing, there were these further invitations to show the work in different ways. Starting in Lewisham and then starting to spread out across London. And for example, this was an invitation from the Bloomsbury Festival. So this is Euston Road. And when I first came to study in London, Euston Road had this reputation for being the most polluted road in the UK. And there was something really powerful for me. This is an 80-metre stretch, but yeah, just to install the work in this location. I like this image of this smoking seemed kind of somehow inappropriate. And then yes, there were then these further invitations. So JCDecaux, who's one of the really big companies that own these huge digital screens around London and the UK, and also different countries, they then invited me, and through conversations with Lucy, with the producer, to use these locations through something called the community channel that they were starting. And that was a sort of an extraordinary kind of opportunity where these screens are kind of found in really sort of public places, and these it seemed to sort of be an opportunity to sort of engage in a new way. So some of them, they started off as still images, and I thought there was an opportunity to the conversations that I had with the activists when they came to my studio to be filmed, to get out of breath and to be filmed, and those become the basis of the drawings. There were certain things that they said, for example, like local air pollution, global crisis. This is TED. The image before this is the right to breathe clean air, question mark. And Rosamond, for example, was do we all breathe the same air? And this was exciting to me, and these locations too, because there was this sort of tension created between these locations, which are usually, kind of used to advertise things like, sort of holidays or kind of cars or, furniture, different things, different products. But here they became these sort of pockets to kind of engage with this artwork. And it started then to be on these screens sort of up and down the country. But these sort of moments just to sort of engage with these images and these sort of provocations and these questions. And then as the drawings were, played the wrong screen, okay. Then these sort of materialize in, let me turn that up. Oh, you can hear it. In train stations around the southeast of England. And I really, I love this idea that in locations where often very brightly coloured images would be shown, as I suppose as the default, these graphite kind of monochrome images might catch someone's attention or imagination in these spaces. And again, there's sort of tension at times when the animation slows down and you think it might stop. And I don't know, I realize it's interesting you mentioned about being a parent, and I remembered this moment, sort of just making sure that my sons are okay, and just peeling around into their bedroom when they're asleep. And the thing you're looking for is just this moment of movement. And as soon as you see that, there's a kind of calmness that ascends. So I think this anxiety and it kind of plays a part in sort of the way that the work tries to activate as well. Just a few more of the screens that appeared. So these different forms were kind of fascinating to me, always playing with this tension of the sequence and then the sort of the animation. And then the culmination, which took place of this part of the project, which was at the year's end of the Borough of Culture, Lewisham Borough of Culture. And this is Lewisham Old Town Hall, which became the projection point for the completed animation. And here there was an amazing kind of synchronicity, Breathe starting in 2012. Talking to Professor Frank Kelly, he describes as kind of, the kind of consciousness and awareness of the challenges of air pollution being sort of structurally at quite an early stage. But what happened within that time, and then what the first stage of UNOS happened, and then at this point, with Sadiq Khan then pushing through the second phase. And here's Rosamond, and there's Angeli, who I also mentioned, the different activists, and the current mayor of Lewisham, who was the deputy at the time, and Shirley Rodriguez, who's in charge of looking at the environment across London. But this sort of synchronicity seemed really kind of interesting, and how the project, I suppose, this political dimension and policy dimension started to sort of become, where this line between, this was an artwork, but then it sort of also started to become and synchronize as activating the language of a campaign as well. And this started to become really kind of interesting. So I think, I suppose I experienced drawing someone as an act of empathy. One, I don't think that's straightforward. I think it's complicated, and it's an intense attempting to think or draw yourself into a sense of another person's life, their emotions, their story, and spending time making drawing after drawing of someone else, you develop this heightened sense of that person, and with making breathe within my studio, I suppose. Each drawing I'm making, there's a sort of the time that it takes, this sort of oscillation between both kind of feeling very enveloped and it almost feels like you're holding that person, but through the process too, inevitably you also then there's a sense of a distance between you and the making. This sort of the longevity and the endurance of doing that, and there's something really kind of important to me in the meaning of the work behind that, and this sort of continuous shift and undulation of a sense of that person. And I suppose making the challenge of making these 1,300 drawings, the thing that really galvanized me was this this idea that somehow that animation became this metaphor for the essential collective action needed to cure all the many challenges we have in the world. But in this case, the action on a clean air future. And I think the sense of as certain people particularly affected by air pollution as Ella, people with a fragile system, but also people who are living in different locations, etc. They were all passively and insidiously affected, but an essential point of the planet is going to be that if politicians and global leaders are going to I suppose think about people that are being particularly affected and whose experience the world are very different to their own. So for me, this sort of this radical kind of sense of empathy seems really, really sort of essential. So let me just show you this directly of the animation. And working with the different activists, and also the sort of synchronicity with the kind of drives of different people. I spoke about Sadiq Khan, and there was also this 10-year anniversary, which coincided took place in February 2023. And this screen, we then went back to the centre of London. This is on the South Bank. This is the Rambert building, which is sort of opposite the Hayward Gallery. And this bringing together of many people to mark this anniversary and to kind of, I suppose, raise awareness again of this now this drive to make breathing clean air a human right. And this night became a night of animation, but also of poetry, of music, and with different people speaking, including Sadiq came. And there was it was an incredible kind of focus and interest in this anniversary, and it's really interesting working with Rosamund and her desire and to work with artists, and this sort of conversations that happen, and I suppose this how you communicate, how you engage people, and the different ways that's possible, and where work is shown is okay, brilliant. Yeah, I'm just coming to Lahore now. So, and these are just the images of what's happening all night. And this was the kind of image from afar of St. Paul's on the left. So just before talking about Lahore, just to talk about the posters which were on the walls for a year, and you kind of see this the particles which are settled on the surface and the kind of impact that the air pollution has had on the images themselves, and this combining of the particles of the drawing with the particles of pollution sort of added this new dimension of sort of seemed to have this sort of poetic dimension to it, but also kind of the horror of the particles that are in the air. And there have been different invitations for Breathe. This is Salisbury Cathedral, which I showed earlier in the year, and that's just to give you a sense of scale of the images. And then in the cathedral itself, I suppose the concentration and the focus, the sense of hope and activation of the space, looking up, looking out, and looking over, took on this new dimension and an emphasis within this environment. You can sort of hear some of the music playing, which became added a sort of new dimension. It's just when evensong was happening within this space. I'll just move on to then just to show the leap then to working in this international context, just for the final few minutes. And I suppose this relationship to the challenges within different parts of the world, things that are shared, but the very different particular circumstances which bring about the challenges there. And this is Abid Omar, who's a clean air activist working in Pakistan between Lahore and Karachi. And he runs an organization called PARCE, which is Pakistan Air Quality Initiative. And what was really amazing was that for Abid was that the realization that this data wasn't being collected about the impact of the levels of air pollution within Pakistan and Lahore and the big cities. And his work started by installing these clean air monitors to really track the changes, to try to raise awareness and raise consciousness about very kind of the scale of the problem. And just within the last few weeks, Lahore has been officially recognized as the most polluted city in the world. So going to Lahore, and this is the animation of Abid, going to Lahore and showing the work within the city, both on the streets next to really busy roads as posters, but also on screens that are appeared. There is 1,500 screens across the city. The city is just encrusted with so many kind of screens showing animation. These are the CCTV cameras of the screens, which are by the road. You can see people going past. But the gives you a sense. Yes, it says blue skies in Pakistan, which is a question mark, which is something that Abid. I mean, he's what's really amazing is that Abid is now appearing so much more increasingly over this period of time on local national and local news that's happening, because this time is seen as the fifth season in Lahore where the pollution is so bad. This is the Mall Road, which is one of the busiest roads in the city, and again the sequences happened. This growing of the artwork seemed really important, and as the potential of Breathe is as that Breathe travels to different cities and different countries to draw a different activist in that context, to engage in conversations as we did. We have done in London, sort of interdisciplinary discussions, but also we did in Lahore between people, representatives from law, from local government, from policy activists, from public health and science. But also, you know, how do you engage with people that aren't getting into those contexts? How do you engage people out in the streets? You know, these kind of questions became really important, and it was sort of mirrored within the different ways that Breathe was shown within the city, both on the streets but also in public spaces. So this is an amazing historic building called Bradlaugh Hall, and this almost becoming like a lung in itself, holding animation and I suppose stimulating conversations. And the project was covered really widely in media, both in Pakistan and also in the UK, which was really exciting. Okay, I'll leave it there. Thank you. Sorry, I rushed a bit at the end.
I know, but I'm sort of glad you did, so we can
Exactly. No, totally.
But there's amazing work, and it really reminds you of the power of art to sort of raise awareness of issues. It was really poignant seeing those silent images in places and points of absolute pollution. Don't close this down, because
this moves on to the next.
Richard.
Yes.
Fantastic. Yeah, really fascinating. Thank you so much. So our last speaker, after which you will actually get to see everyone, is Dr. Richard Alderslade, who's also at St George's. But he's also worked for 40 years in public health at national and local health administration, research and higher education in the United Kingdom, for 10 years in humanitarian and developmental international health. He holds the degree of MA from Oxford and is a fellow of the Royal College of Physicians of London and the Faculty of Public Health. In fact, his career is so extraordinary that I couldn't actually read it all to you. I would be here forever. So I'm just going to highlight a few things, and if I've missed out something that's really central, please tell them, because I probably will. But just to give you a flavour, in the United Kingdom, his work has included 5 years of working with the UK Medical Civil Service. That's including a senior medical officer appointment as private secretary and the chief medical officer. 10 years working in public health within the National Health Service as a consultant in public health medicine and regional director of public health, and 3 years as a manager of community health services, and 1 year as a professor of community care. So in fact, I've been calling you Professor Richard Alderslade.
That's very kind of you.
Anyway, and internationally, he's worked for 8 years in humanitarian public health work with the WHO, their regional office for Europe, 5 years managing the office's humanitarian programs within the region, 18 months for the European Union, and he still acts as advisor to the WHO's programme on health and migration. And there's so much more. So the fact that we've got the three of you together is really exciting. Thank you so much, Richard.
Well, that's very kind. Thank you very much indeed. It's great pleasure to be here. I'm just going to spend about 10 minutes trying to give a global perspective to what you've heard from Helen and Dryden. And I just would like to pick up on Dryden's last point about the power of art, and increasingly thinks about the limitations of the power of science in numerical sometimes terms, and needing other disciplines around to convince and persuade, and as you've so beautifully illustrated with your pictures. And perhaps I'll try to come back to that towards the end. In terms of, I was interested in Helen's sort of personal history, and my personal history was that I got involved, or I thought I wanted to do public health because I worked for a lung cancer surgeon at Hyde Park Corner a very long time ago. And in those days, 20 a day was usual, 40 a day was not unusual, 60 a day was a little bit unusual, but I did have some patients who smoked 80 a day and had been smoking 80 a day for a very long time. And I suppose, as you explained, I think one got the sense that smoking was the big issue. And the 1956 Clean Air Act had sort of sorted that out, that it wasn't such an important issue as smoking. And smoking still remains a very important issue. But you beautifully illustrated, I think, how respiratory problems associated with air pollution have become centre stage. And in a way, that's where I'm going to start. Centre stage, and you particularly talked about children, and you talked about health inequalities. And I think that air pollution is a big driver of health inequalities. So in terms of, well, this is a picture of air pollution. This is, I'm not sure where this is. I think both of these pictures are from South Asia, but this is what we're talking about. And I can remember pictures of London in the 1940s and 1950s. It didn't look too different to that. So quite a lot of progress was made by the Clean Air Act, but perhaps not enough in the way that you described. We're a little bit out of. Not sure what's happened here, but I'll just go on. So in terms of what the global thinking about air pollution, carrying on with this story, it's now seen as one of the top 10 threats to health globally. If I was Dr. Tedros, the Director General of WHO, standing here, which I'm not, but that's what I would say. This is one of the top 10 threats to global health. This is the definition: contamination of the indoor or outdoor environment. And I'll show a slide in a moment emphasizing the importance of the indoor environment in many countries. Any chemical, physical or biological agent that modifies the natural characteristics of the atmosphere. So there are some of the reasons, starting with tobacco smoking, household combustion devices, I'll talk a little bit more about, motor vehicles, industrial facilities, forest fires, etc. Very importantly, many of the drivers of air pollution, for example, the combustion of fossil fuels, are also sources of greenhouse gas emissions. And so this link between air pollution and the climate crisis and policies to reduce air pollution really offer a win-win strategy for both climate and health. And I think that's very important. The estimate, this is a WHO estimate, air pollution probably kills, actually this is from 2017, I think the latest estimate's a little bit more than that, somewhere around 6 or 7 million people a year globally die from exposure to air pollution. And this looks at some of the other issues, metabolic risks, dietary risks, tobacco, malnutrition, water and sanitation, low physical inactivity. So air pollution is well up there and kills an awful lot of people every year. It's important also to think about household air pollution, and many low and low middle income environments. Household air pollution, kerosene, solid fuels, wood, polluting stoves, open fires, lamps, etc. Somewhere over 3 million people a year die from strokes, ischemic heart disease, COPD, lung cancer, and lower respiratory infections. So we're talking about a really big burden in global terms and contribution to the global burden of health. Not to forget cigarette smoking. Indoor cigarette smoking is a major contributor to indoor air pollution. And then you can't, sorry, something's happened with the slide, but just to say that we're talking about invisible particles. So in terms of microns, 10 or 2.5, the largest particles from pollen, sea spray, wind-blown dust, agriculture, roadways, mining operations, but it's the finer particles, the 2.5, that are really important. Combustion of fuels, power generation industries, secondary sources, chemical reactions, smoking, traffic, industrial activities, power sites, construction, and waste burning. And it's these particles which are particularly dangerous. The 2.5, they can enter the lung, they can get through the lung into the bloodstream, and they can cause this range of diseases which we've been talking about: cardiovascular disease, stroke, adverse perinatal outcomes, and lung cancer. So it's these very tiny particles which are not extruded, which enter the lung and enter the bloodstream, which are really dangerous. So just a final slide, what can countries do to reduce air pollution? What are the policies? And Dryden, you talked about policies. Well, sustainable transport in cities, solid waste management, clean household fuels and cook stoves, developing a market for renewable energies, implementing industrial emissions, and controlling environmental tobacco smoke. Now, as you look at that list, you realize that these are, from a scientific point of view, overwhelmingly evidence-based and convincing. But from a social and political point of view, not necessarily so. And that's where I think your images and the art and science together can make a very big impact. you reminded me, Dryden, earlier that when I was living in New York in the early 2000s, the then Mayor Michael Bloomberg introduced the ban on smoking in bars and restaurants and public spaces, which has become not universal, but nevertheless generally accepted around the world. You can't smoke out there in Tooting High Street in the way that I used to do when I was a medical student at St George's all those years ago. The interesting thing is that Bloomberg is a fascinating person. He's one of America's richest men, but he has no public health background whatsoever. But he does get it. He understands. He can take these messages. He has some public health sensitivity, and he got it done. And so political commitment, is that what we're really talking about? Is there the political commitment? I think the link with climate justice, the climate crisis and the climate justice is very important because it adds to the intensity of the feeling that something has to be done. But you showed several pictures of Sadiq Khan and his struggle to get the second part of the ULEZ implemented and the social and political backlash against that, although the evidence is very convincing in terms of its impact on public health. So there is always this need for political determination. It won't always be science-based. Well, it will be science-informed, but can bring this wider sense, which you've illustrated with your drawings and your talk about the human right to clean air, linked with the human right to health. Well, of course, we're not there yet, and we need more political determination to move in that direction. And Khan, I think, is a good example of someone who has expressed that. But you see it also, you see this controversy also, or potential for controversy also, in the recent debate about, in this country, about smoking in pub gardens. It looks as though that's not going to go through. You won't be able to smoke outside schools or outside hospitals, but you may continue to be able to smoke in pub gardens. So the science somehow doesn't seem to be enough in social and political terms. But the science linked with the sort of artistic views, the artwork that you have wonderfully demonstrated, can, I think, make a more powerful impact. But it, even then, may not be enough. And you need someone like Mr. Bloomberg, I think, to come on and really drive it through with absolute determination. But there are not so many of those. Thank you very much indeed.
Absolutely. That was really fascinating, really highlights the challenges and the very difficult conversations, but the way the different knowledges and different cares come together. So I loved your idea of drawing being sort of sense of care with that delicate line, and then your sort of individual personal care with individual patients all pulling out and having public health policy. Can I invite you to sit down on the sofas, and I'm going to, I hope, reveal them in that if I stop sharing and put the camera on, those of you at home, please wait till the minimize. Not on. Yeah, fantastic. Can you now see them? Can you check? You can see the one this is excellent. So this is Dr. Helen Meredith. This is Professor Dryden Goodwin, and this is Professor Richard Alderslade. So now you have the reveal, and hopefully they're going to pick up the next 10 to 15 minutes, pick up some of the themes from this. And if you want to put some of your questions in the chat, and then we'll have a chance for Mike's going to pick up the questions, observations, and take some questions from the room as well. So any thoughts?
So I have one thought. It's not really about, isn't it? Isn't about air, but I guess the thing.
1 minute, I'm going to get you a microphone.
Okay.
If we pass the microphone, I think that will probably be easier for people at home. Yeah, there you
go. So I guess really interested. So really, I think echo exactly what she said. That's the dynamic between arts and science and trying to move forward that message, because I think messaging and how you move. You said this pollution's invisible. It also, we're so wedded to our lives. We're wedded to using our cars. One of the things we're saying when we were talking pre-meet, I think I looked it up. There's approximately 60 children and young people a year killed in car accidents, and we accept that as a price for the convenience of what we do in our day-to-day lives. And we thought to contribute to air pollution, thought to contribute to about 50,000 deaths in the UK. And again, this is how we live our lives, this is how convenient. But so I echo Richard's thoughts on that. My point is a little bit coming to one side. I thought it was really interesting. So much of what you do is a respiratory in terms of breathing in the lungs. Everyone expects you to get the stethoscope out and so on. But actually that act of breathing, that work of breathing, that informs me so much about what's happening with a patient, whether they're well, whether they're unwell, how unwell are they. When we're during the pandemic, we'd have them on the phone about listening, but actually that looking at someone, looking at how they breathe gives me an enormous amount of information. I thought it was really fascinating seeing your series that, that gasping at my question, which is how much anatomical sort of work have you done to sort of get that? I mean, I guess it's sort of appreciation for what you managed to do, but I just thought it was fascinating, maybe not be a question beyond that, but fascinating to show that work of breathing, which to me is key for working out how well or someone is, how are they. It just was really interesting.
Yeah, no, I thank you for the question, and but I think you're right that I suppose the recognition that the rhythms that you see every day, I suppose that are kind of hyper consciousness, that if someone starts to breathe out in a laboured way, or they seem to be fighting for breath, it immediately raises alarm, and so that breathing. The work of breathing, and the fact that it's not within a calm way, so it's amazing how sensitive that all of us will be to that if we're in a collective group and someone seems to immediately think there's something wrong. So there's something about that kind of the fundamental trigger for me within that action of and of course that comes through sport, and you see, you might see that televised during the Olympics, but then but that makes sense because it's in context. So the idea of taking that action of someone really trying to catch their breath or to fight for breath and to place that in public space, I suppose that tension seemed to hold hopefully some attention. And the fact that it's through drawing, how drawing in its way, it's as much about what you put in as what you leave out. That activates the imagination as well, how the body is formed, and actually sometimes very few lines may imply a lot. So yes, I suppose that there is something about that sort of that tension that was important. And I was thinking about what you were saying about engagement. How do you, and it's fascinating what you were saying, which is about in how one creates circumstances where people are engaging with an issue, or how you were describing, Helen, about how a patient might modulate their behaviour because of what is clearly affecting and making their conditions worse. But it seems to me that is really kind of critical, how you engage people in that process. And just thinking, for example, in Lahore, trying to find people who are activists and engaged with it, it was a harder task than in the UK. And the fact that people within activism within the UK are usually sort of people white middle class people who seem to have a space to maybe reflect on this, but how many people are in a situation where it's the day-to-day struggle of existing and being in is hard enough to be able to engage with issues. So there seems to be something really critical around how do you engage people and how do you raise that consciousness, so much so that political leaders recognise that tough decisions have to be made, which goes back to your point, Richard. So engagement is so challenging.
I was going to ask Richard actually about picking up on that and going back to your thing of visibility and invisible. Is there something about it being invisible that makes it so hard to engage with people, or sort of to get around those competing needs? The difficulty that Sadiq has had with the EULA zone, and the fact that the competing need of priorities for financial priorities, and it gets more expensive and wanting the cars there, and yet people are actually, they are killing their children. Children are dying as a result. If it was more visible, and your work really helps to do that, and the deterioration, would that make a difference? What is it that are the real challenges for public health?
Well, thank you. I think one of the things that WHO has learned is that doing what I did just now, which is telling you that 7 million people die a year. So just numbers of deaths don't really, that sort of information doesn't necessarily capture people's imagination. And you need to capture their sense of emotion. I mean, somebody, a political scientist, I think, said that, I think of recent events, in politics, emotion outweighs reason most often. And so you need to give people, I take your point that a lot of people don't, you may feel that the burden of everyday life is such that you don't really have time for this sort of discussion. But I think you can capture people's imagination. Children do. If an issue which affects children, adversely affects children, will capture people's imagination. I think there's a lot of interest in the health inequalities that you spoke about, particularly if they're related, say, to poverty and gender and the inequalities and stuff. So I think those sort of issues capture the imagination of people, and art does. I mean, if you look at what you've been presenting, Dryden, it does capture people's imagination, and you've demonstrated that. That's I think one of the virtues, rather than simply bald numbers and saying, well, so many people die from air pollution. Would visibility help? Possibly. I mean, cigarette smoking is very visible, and yet you think of the social and political resistance. You go back to when the law about smoking in bars and restaurants and public places came in here. There was still very strong resistance, even though it was visible. So I think you need to capture people's sense of emotion, and that I think is where art can help.
Interesting. And does that help with conversations in the clinic as well? Because there must be times where you're trying to encourage someone to stop smoking because they've got a severe respiratory condition. And I mean, I don't know if they've stopped it now, but I used to still see people at St Thomas's, with drips and with catheters, and they'd be smoking. And I don't know what was wrong with them in the first place. It just felt that smoking can't help. You can't help that. How do you go around those conversations?
So I think the first thing to do is, the person is addicted, it's not their fault. I think that I recognise that smoking is an incredibly addictive substance, and tobacco companies are very good at marketing their products, and they have been for a number of years. They're getting around whatever bans they can do. They're now own 50% of the vaping companies in the UK. They will continue to market heavily in any way that they can, and so the person sat in front of me is a victim of someone else making them addicted to something, and it's incredibly difficult. So I start from a conversation of, obviously I'm going to tell you that stopping smoking will be the best thing you can do for your health, but that is something that can be very difficult to do. And I don't think cigarette smoking, various people I'm not an expert on addiction, but it has some incredibly addictive properties to it. And again, when you talk about figures, it will kill 50% of the people who do it. And yet you think, well, that's really bad. That's really bad. It costs me a lot of money, it stings, and it's going to kill, fair chance it's going to kill me.
Yeah, 1 in 2% is pretty
but that doesn't, again, on your day-to-day basis or whatever. So I think starting point is openly discussing how hard it is, and then trying to say, well, if you're in a position to think about, and the problem is when people come into hospital, we can potentially try and capture them and offer them support. And it is, I have a number of patients who say, well, I'm never going to smoke again. And you say, well, that's fantastic, but it's going to be really hard when you get home. Can you have some support now? Because this is the easy bit. You feeling really unwell is the easy bit. It's so much harder when you get home. But I think it goes just back to that thing about a little bit, you almost can't imagine something's going to happen to you. I think that's, or the converse of it, you're so worried about that outcome for yourself, whether it's lung cancer, COPD, heart attack, strokes, whatever, that you can't think about it because it scares you too much, and therefore you keep. So I think it's what captures it for that person. I think just empathy for me when I'm talking about smoking with people, it's empathy about how difficult it is, and if you would like to talk about, we have a bit of a chat about some things that might be challenges for you, and can we help with any of those things. But ultimately, you know, people smoking outside of hospital, and we do ban it. It's incredibly difficult for people who are with us here, and if they're going through a really difficult period, we've got to do better at supporting them around withdrawal from their nicotine. But if we've done all we can, sometimes people, it is the worst period of their life, and they need their cigarettes to cope with that. It's very, very difficult. But I think it just echoes those things again around facts don't stop someone. It's that emotional feeling, but addiction as well. But yeah, cigarettes are, I think the key bit of it is the tobacco companies are evil. Let's see what we can do to help you. That's my person.
You all three have empathy in a variety of ways, including through drawing. Did you want to you coming in? Then I was going to open it up to questions and discussions.
I just wondered, because of the sort of collective experience we've had in relation to breathing through the pandemic, whether there's a trackable change in people's consciousness around breathing within the conversations, or whether that there isn't such a link that you can see. It just seems such an extraordinary heightened moment about the consciousness of how individual breath and then collective breath, how the interdependency that we all have. But yeah, kind of really interested if you've seen any changes at all.
The pandemic was obviously an enormous impact on many people. I mean, the big thing we saw around is increased frailty and deconditioning. But yeah, I guess people focusing on breath more, yes. We had a lot of breathing pattern disorder post-COVID, really interesting. I think we're just starting to, I think COVID will hopefully help us with some post-viral illnesses, but people, long COVID, whatever you say. Our respiratory physiotherapists were able to help a proportion of people with working around breathing pattern. And that's, I guess, our breath is, and trying to explain that with, so again, it helps us understand breathing pattern disorder. So actually how you're holding your breath, how you're controlling your breath, actually causing or being part of a vicious cycle for your breathlessness. We've recognised as something contributing or sometimes overlapping with other illnesses like asthma, for example, but sometimes there's some problem in its own. And I guess the thing that COVID has done, because we had many people who were breathless for a long time following on from that illness, long COVID, whatever, for whatever reasons, and there were different reasons in different people. We've only just don't understand all of it, but hopefully we'll have some better understanding over the years. The thing that the breathing pattern and how the mechanics of breathing, and the physiotherapists really were able to do some very positive work with some people around that. But to be able to talk to people about, how you hold tension, that work of breathing, how it makes it worse. So from a very practical point of view, that I'm not sure. Health anxiety, I think, increased, but yeah.
I was wondering, picking up on that, Richard, I was going to ask you, yeah.
Could I just mention a sort of public health debate at the moment? Sometimes the science is disputed. You mentioned vapes, and the general public health view in this country, as you probably know, is that vaping is far less dangerous than smoking and cigarettes, and that it's a useful adjunct in smoking cessation. That's not WHO's view at all. WHO's view is that the vape contains known carcinogens, and the medium to long-term health effects of inhaling those carcinogens are not known. And therefore, it's not appropriate to recommend vape. So I'm not taking sides in that debate, but I'm just saying that sometimes the science is disputed. And then you think of, you mentioned the impact of the industry, of course, who are, we know that they're promoting these vapes, but they're promoting the idea that they are a useful adjunct in smoking cessation. But the number of children vaping is increasing significantly, and that's very worrying. I think if WHO is right, that's very worrying. And you go back to the 50s when the tobacco industry, of course, was saying that smoking was perfectly safe. I mean, it was just perfectly safe. Indeed, it was that there were advertisements weren't there that it helped people with respiratory problems, and you just worry if that sort of history is going to replay. Thank you.
That is very alarming. Are there any questions? Does anyone like to say something? Thank you. And then while we're having a question in the room, are there any in the chat that you can put there? So if you haven't put one in the chat yet and you'd like to, do ask a question in the chat and we'll take, can we bring the microphone to you?
Hi, and thank you very much for your work. I think it's a very interesting point that facts and figures are obviously sort of, for me as a scientist personally, I like to look at those, but I understand for the general population, the emotional aspect is more important. But I was wondering what your thoughts are on the world is getting increasingly more complex. We see these awful emotionally affecting things all day, all the time. And I feel like a lot of people are now, the more emotional things get, the more likely we are to just try and move away from that again and avoid it. So I wonder if where the responsibility really lays, is it with the people to understand the issue from an emotional and from a facts and figures point, or is it really the politics that need to make decisions that are positively affecting the population? Because as humans, we can't be expected to do these changes.
Thank you. You raise a lot of really complex ideas. So can I hand this back to somebody who wants to answer? Hand it between yourselves. Yeah.
I think those are some very important issues. The generally accepted definition of public health is that it's both a science and an art. So the science is very important, but the art is deciding what to do with the science, and that's what politicians are for, in a way. So and the art also has to deal with the fact that the science changes. You think that in COVID, the science changed every week, and the politicians struggled to keep up. So it's both the science and the art. I don't know. I don't think I have an answer to your point about the complexity of the world and how people deal with that. I do think you're right. That some people just say, well, it's all too complicated, and what do I do about it? Well, go down the pub and have a cigarette. I think probably that's what I might do that myself, but not a cigarette. But
yeah, I was just thinking about sort of now the narrative that is told, and also contested evidence, and how and related to political expediency, and thinking about the election in the States, and the kind of what's driving that, and the narrative being told that it seems that very probably complex challenges have far simpler solutions is something that's very attractive. And that's obviously had a big impact in the States in terms of the election. So yeah, I suppose I'm finding it very difficult to think of anything positive within that. But I think that yes, I mean, it's interesting that actually thinking about evidence-based, and I as an artist I was invited to do a residency for a pilot scheme where three artists were based in the civil service in national government, to see what contributions artists could make to policy making. And that was kind of really fascinating and revealing, and whether the kind of thinking that an artist might bring in as a component within and reflecting on the work that's doing, but also as in conversation with policymakers, what that could contribute. But within that situation, it became very clear that there was some extraordinary free-thinking policy design, but what happens when those designs are then sent up the chain of conversation to ministers, how it was described as 8 to 10% of policy is based on evidence, and where ideology comes in, that's a kind of issue. So a huge issue. So yeah, although there is this kind of extraordinary work going on within the civil service, it's how it actually gets through. So evidence. I mean, we're in a time when the whole relationship to experts is being questioned, isn't it? And obviously that becomes very, very problematic. There's lots to say, but I should hand on.
No, I guess they're my only thoughts. I don't think any of us talking really about individuals doing it, but a politician is going to reflect what his community, well, his or her community gives from what to do. So I guess as individuals, we can be the voice of the community, or we can gather others around us. And essentially, a politician, I mean, if we took Trump, he's now campaigning on things that 10 years ago, he said the absolute opposite of. They will move to what they think will get them elected. And if enough people say, well, actually, this is of key importance to us, that's what your politicians will start saying they want to do. And so, but as an individual, I think it's very, very hard. And equally, do you think, I did cloth nappies and, trying not to fly. And then you see both from an absolute devastation in terms of what's happening with war in Ukraine and Gaza. And then you also just look at those bombs and that destruction, obviously human life, but then the air pollution from it is like, what can I do against that? And I get what you mean. It's such a tiny amount, but equally, if we don't all start talking together and standing together, then we never move forward.
And if you think of the people that Dryden worked with as well, they're individual people, but individually sort of galvanizing other people and then sharing it with you as well. Did you want to add something, Richard? And then I want to go to Mike to gather up the questions from the chat.
Just very quickly. Some things of that. And picking up on your point, but Dryden, I think there's evidence-based intervention, there's evidence-based treatment, but I don't think there's evidence-based policy. There can be evidence-informed policy, and that's the best that you can hope for. The politicians, the nature of politics is to try to balance all of these different interests and expectations. And the best you can hope for is that people will try to balance those with some sort of sense of value. And you talked about human rights. And the answer, I think, is that some politicians do try to do that and some don't. And the better ones try, but it's difficult. So I would never see politics as anything other than very difficult and challenging. And like everything else in life, some people are good at it and some people are not. But I don't think there's evidence-based policy. Most politicians, I used to work in the civil service a bit, they wouldn't recognise that. The best of them wanted to know the facts. They would start the conversation by saying, well, what are the facts? But others didn't really want the facts because they knew what they wanted to do anyway.
So all the way through the pandemic, we heard it was based on the science. Can I ask you, Mike, if you don't mind gathering up the questions in the chat?
I just got the one at the moment, so yeah, please do send any others through. And this is from Sam, who was so keen to join us. He was listening in on the train on the way here. So this question, which you sort of answered previously with one of your answers already, but yeah, potentially we can expand a little. So hi, Dr. Meredith. In daily clinical practice, I wondered how you approach the conversations around air pollution with your patients. Would the best approach be to inform of the risk of prolonged exposure and think about how to minimise pollution exposure? Many thanks.
Thanks. And thanks for chipping in from outer sphere.
Yeah, so I think what I said right at the beginning is just sort of actually embarrassment really around the lack of what I've done with that. And this has helped me sort of think a bit more about it. Although I was aware of, I'm group lead here, so I get asked to comment or formulate a response to sort of when you get national guidance like NICE guidance. And I was aware that NICE guidance came and asked about what are you doing to talk with your patients about this. We do sometimes, but as I think my main concern, my main issue, worry, lack of time, is it not quite knowing what the right things to say? But I think it's a really difficult balance. I'll have someone in front of me who's very engaged with their healthcare, maybe very, maybe, has got their smartwatch on and is monitoring all sorts of things. And then if I add another thing in for them to monitor, that they're just actually then hyper-focusing and not actually living, not breathing, not this active life. The contrast is I'll have someone who's still smoking, who's So Mike, you're getting this directed at you because you question, but you can be the virtual Sam. You know, and we get the whole gamut, and it's very, very difficult. If we look at another strand of the pandemic, I've still got patients who, I had someone in my clinic in the last few weeks, he's still not going out to do activities that he used to enjoy. He used to go to the Hay Festival every year. And has avoided that. They've got bronchiectasis, so got some increased chances around respiratory infections, COVID. You know, he's got his vaccines. He's got other. I was actually trying to go, no, go. You only get one life. This is something you really enjoy doing. Go and do activity. He hasn't gone to a restaurant for 4 years. He hasn't. You know, he's still very, very worried around. And so I do not really want to introduce with them, well, but do go, but do the air pollution tracker on the day. You know, how much time am I going to spend talking about that and adding to anxiety? So I haven't got there, I guess, is the answer to that. I've got a spiel. I'm quite comfortable to talk about smoking. I'm quite, you know, I can spend a long time talking to people about their weight and how it impacts on their health and how we could help support that, and what some of the issues that might be causing that problem for them. And again, that's not their fault, that society as a whole, you know, there's lots of things that I can talk about with empathy and hopefully bring up in a useful way. I don't think I've quite got there with how do I talk about air pollution? How do I talk about it in a way that empowers someone with feeling that they can still do the activity that they would want to do, or actually when I'm trying to encourage them to do more activity, not restrict it because they're now terrified to go outside because of that. So maybe some, if anyone has suggestions from the floor. So do bring up a little bit. We've got some asthmatics where they are triggered around things, and we talk about where they can access resources around monitoring and maybe doing indoor exercise on those days, or trying to sort of walk away from main roads. So we'll talk about those things in some people, but I don't think as a respiratory community, or maybe it's predominantly me, but I think I agree. I don't think we're quite confident enough about talking about this. I think we're a bit late thinking about it, but also how not to limit people and then make their quality of life worse in other aspects.
That's really interesting. And yeah, I was going to say, can we have one more question? All right, 2 more questions, and then we will move and have a drink, not a smoke, and carry on the conversation. If you've got other questions bubbling away, I'll bring you the microphone.
My name is Mohammed. I am a registered nurse, and I was also a global health student in St. George's here. My question is to Dr. Helen. Working in the clinics, especially in the respiratory wards, I am always sometimes faced by this dilemma where patients ask if they could go out to smoke cigarettes within the hospital environment. And sometimes you tend to ask yourself, should I do it? But then you also tend to be a bit empathetic, knowing someone has been smoking for over, God knows how long. And sometimes while working with that patient, if you do not comply or do not agree to their request, sometimes might change, your interaction with that particular patient for the rest of the day. So facing this dilemma, how would one address it?
Question in your head. Well, I pick up the second question, and then I can throw them both at all 3 of you. Himani, did you want to add?
Thank you. Thanks for such an engaging conversation. My question's to Dryden. I'm also an artist, and I'm from Delhi, and I think Delhi has recently overtaken Lahore in being the most polluted city in the world. Thanks for sharing your really powerful work. I was hoping to also be in Lahore for the Biennale. My question to you is that, did you find any difference between the UK and Lahore when you screened those images of the drawings, of all your drawings from the Breathe project, just from the regular passerby, outside of the context of the Biennale? I'm particularly interested in the emotive reactions in South Asia, because I feel, or as I've observed, that life sort of goes on. There's so many people and so many other problems. And as you very rightly said, it's the invisible. I mean, Invisible Dust is an organization, but I made some connection earlier in the talk about this being an invisible issue, despite being right in our faces and in our lungs. So yeah, just interested to know the difference. Thank you.
Thank you, Imani. Do you mind if I put these back to front and maybe throw that question to you, Dryden, and then go back to with the differences, and then go back to Helen in the clinic and maybe draw out Richard's final comments, and then we will.
Yeah, thank you. Yeah, I mean, I think to start off with the recognition, I suppose I could start with the idea of abstraction and what Richard said about how the abundance of information to tackle things of such a scale is almost, on a global scale, is so huge, and the idea of looking locally in particular cities and with their own unique challenges, I think is really important in terms of what they may share, but also the differences. And you spoke about cotton, and we did a trip to Belfast, myself and Lucy Wood, the producer, to explore the potential of breathe in Belfast. And there's a very particular relationship to coal fires there, and how that is affecting and contributing to the challenges of the vehicle emittance. But so in every context there's unique things, and then growing out of what you've said, that this idea that Lucy Wood describes it as a dial of change, and where different cities are within that, and because and the challenges within Lahore and Delhi, as you describe, and that they're so much larger in terms of the scale of air pollution. I mean, times 10, compared to the challenges that we have in London, for example. Although obviously that's having really big effects. And then how I suppose that the curiosity, both how an artwork might contribute to stimulate conversations, but also be a way to bring different people together within those different contexts. That was really fascinating, and this sort of shared learnings between the global north and the global south, and that potential. So and who knows how many cities Breathe might go to or not. But I think what was really also recognizing is the different cultural and sensitivities and relationships also, as well as the societal and the kind of challenges that different communities of people have, but also the representation of the human figure within Lahore was really kind of interesting, and the sensitivities around that for different people. And that was a conversation that happened when I was making it, and who this activist might be. But also what it is to go to another city and be very conscious about having a dialogue rather than a kind of sort of saying, oh, I'm an artist from London and this is how we're doing it. And there were some really interesting conversations we had on the street when we put the posters up, and there was a quick engagement with the work, and rightly there was a kind of a question about what is the nature of this dialogue that we're setting up. What is it to go somewhere and sort of when the poster was fully read, it was appreciated, but the question of what is it to come somewhere and say that we have solutions? It's very much not that. It's about the dialogue around the difficulties and the complications of the solutions, particularly to the different environments, the different histories, the different societal changes. So that was really interesting.
In terms of dialogue.
Yes.
Sorry, can I keep that? You could carry on asking Dryden more over a drink. I don't want to cut you off, but I'm aware that we're going to go way after 7. So I was going to move on to Helen and ask you if you could, sort of your advice on empathy and how you deal with that. And then can I go back to you, Richard, for some final thoughts?
Sure. Thank you.
Yeah, I mean, it's a practical problem, isn't it? But I guess the a starting point I was thinking is the person in front of you is very vulnerable in hospital. We're only ever seeing a snapshot of that person. They may not choose to tell us it, or we cannot understand all of their life. And I said they're probably in one of the worst periods of their life coming in. And some people deal with that in a very positive way. I have hugs from, I'm sure you have, you know, we get the most amazing recognition from other people going through some of the hardest periods in their life, and they take time to thank us for some of that. We also get people hitting us. And so from a very practical point of view, sometimes you just have to do what it takes so you don't get hit. And we've had someone on our ward going out to smoke through his tracheostomy, just coming off the oxygen the nurses with, you know, and it's also the practicalities of how we do that. But I think it's incredibly difficult. I think what you need to do is just make sure, have we supported them enough with nicotine replacement? Have we done everything we can and offered things? Because we don't always support and give them enough. And if we've done that, it's a practicality of how do you just help that person through that moment. And also, yeah, so we do. Well, I'm on the respiratory ward and our nurses take people out to have a cigarette. It's because that's the only way we can help manage them through that. But we need to get better at offering them some more support around that.
That's a very pragmatic answer. I never thought one answer was going to be make sure you don't get hit, but that's
Healthcare workers get hit quite frequently.
Richard.
Well, thank you very much. Just very briefly, I was thinking about this balance between science and art, and it can change, and you need to take the advantages when they arise. It's an interesting story, but it's actually partly based here. When the tobacco industry eventually, having denied it for years, eventually accepted that there was a link between smoking and lung cancer, they said it was entirely an individual issue. Dryden, it's entirely up to you. If you want to smoke, you know the risks. It's entirely your decision. But once the science emerged, and senior colleagues here were involved in that you weren't just smoking, you're sitting there smoking, you weren't just damaging your own health, but you were damaging everyone's health in this room. The thinking around the science and art changed dramatically. And the value decision was completely different. Completely different. So all the arguments that it's in your decision fell away. And the tobacco industry was absolutely caught short because it wasn't what they were expecting. But the other side of it, which was the art, was there was a sympathetic political audience. This was during the Blair administration. So the science changed and there was a sympathetic political audience. And that's why we have the ban in smoking in bars, restaurants and public places. But it was built upon what Bloomberg did in New York City, because New York City's iconic status and so forth. So a whole set of issues which perhaps couldn't necessarily be predicted, but they came together. There was a sufficient number of important people with a sense of value that something needed to be done, and the whole situation changed. It couldn't, it couldn't be predicted in a sort of evidence-based way, but as an evidence-informed way, and people taking advantage of the changes in science and people's thinking and understanding about science and the value decisions they were making, and a big step forward was made. So I think that the lady in the audience who said it's all very complicated, it is all very complicated, but sometimes you can make progress. That would be my comment. Thank you very much.
That's fantastic, actually, and that really highlights the value of bringing together different expertise. And I mean, you three really evidence the value of experts. We couldn't doubt the value of experts, having heard the three of you talking and seen your work and thinking about the labour that goes into his work, but the labour goes into public health policy or individuals, sort of clinicians and sort of respiratory policies. It's been absolutely fantastic, and it's just so exciting to have brought you together. Thank you so much to all of you who are online and for your questions. If you have any follow-up questions, do put them in. Do come to our next and last event of the term, which is on graphic medicine, which is on the 10th of December. And that is mainly in the room because it's very hard to do the collective exercises online when it's actually in the room. So do come and join us then. But thanks for joining this evening. Thanks to Mike as well, who stepped in at the last moment. He's not here because he's gone off to prepare your refreshments. And you have no idea what a miracle it is that you've got any refreshments. So we actually owe him quite a lot. And thank you for sharing your evening with us and bringing your questions and everything. And I was just thinking about breath as a wonderful sort of metaphor for exchange, because what you breathe out, I breathe in, and vice versa. So I feel that breath is absolutely essential and central. But thank you all very much. It was amazing. Thank you.
Thank you.
And do please join us because now we've got the refreshment. Please, please come and take part. Is in, I think that it's in H0.1, so it's just around the corner. Yeah, yeah. Follow Richard.
That's where you put some.
We can sing in Korean.
Sorry. That's okay. Thank you so much. Yeah, if someone who knows Nithya, do you know when H0.1 is? Yes. Could you, if you follow Nithya, you will end up with refreshments and not in the loop. So that's probably a good idea. And do you can carry on asking questions and have a drink and asking each other as well. I'm just going to try and give me the fine. It was yeah, and then so it's random to the left. To each one, it's not if you could just ring me, I guess. Okay. Do you need help coming? No. I should have. No, I need help with taking people into the H0.1. They will probably know where they're going. Dryden definitely won't know where it's going.
I don't either.
Oh, Helen doesn't either. Brilliant. So I think do we need to you? No. I was going to finish myself because I don't finish at quarter to. It's just if you don't finish nearly on time,
Yes, exactly.
You're all so fascinating. I could have listened to all of